Recently, there have been reports of locals taking their own lives at various times, where most of them committed suicide at the Inkunda Mahoro market located in Kigali City. As today marks the World Suicide Prevention Day, some residents of Huye district say that most suicide incidents are as a result of domestic disputes.
Back home, I heard that a man committed suicide because his wife committed adultery. But even after his death, the wife never stopped. So in other words, his committing suicide did not change or solve anything.
If only the local authorities could find ways of reaching out to the families, because sometimes you find that a certain couple is having extreme fights or disputes and no one can tell from the outside until one day you hear that the wife or the husband has committed suicide. While on the issue of whether this problem is prevalent among young people, these residents say that some of them that grow watching their parents having disputes do get affected, while others are mostly overwhelmed by the fear of their future, and others commit suicide because their significant other has betrayed them, as they add that this is wrong.
Young people are committing suicide as well, in most cases because they have been disappointed in romantic relationships.
Despite reports of suicides, the Rwanda Investigation Bureau estimates that the number of suicides in Rwanda has dropped by 2% in the past 2 years. According to RIB, in the 2019-2020 budget year, the number of suicides in Rwanda was 291, while in 2020-2021, it was 285. A psychologist and a professor at a university, Professor Vincent Sezibera, says people should normalize caring and showing love to one another in order to avoid depression, which most likely leads to suicide.
What we ask of people is that they care for one another, and if someone falls short, those around him or her should not discourage them, but rather show love, support, and understanding by listening to what is really hurting them and then comfort them.
According to the Rwanda Biomedical Center, people who reach the point of suicide often show signs or symptoms of mental illness, but those around them do not value them. Dr. Jean Damascene Iyamuremye, director of the Psychiatry Care Department at RBC, says the medical authorities have put a lot of effort into raising awareness and training people on how to handle people who show symptoms.
We raise awareness in order to reduce cases of mental illness and other factors leading to suicide. Another thing is that we try to increase capacity in the health sector, like clinics and other institutions that provide healthcare, in terms of increasing the workers and equipment so that we can be able to help people with the symptoms.
According to the World Health Organization, of the 800,000 people who commit suicide each year, at least 60% suffer from severe depression and 90% suffer from mental illness. In Rwanda, a study by RIB shows that 47% of suicides, their cause has not been identified, while 28% is due to family conflict, 8% is due to mental illness, and 4% is due to depression. Land disputes are 3%, and those affected by chronic diseases are 3%. Suicides due to breakups are 2%. Extreme poverty is 2%. Debt is 2%. And losses is 2%. Jane Mutoni, RTV News.